Hi everyone, welcome to this video. My name is Abby. I'm a clinical pharmacist currently working in London. So some of you may already have known my mum recently suffered from coronavirus. During my mum's illness, I was her primary caretaker and I witnessed her journey from start to end. So I wanted to make this video just to give you some tips and pointers on how to stay prepared, just in case you are put in a position where you've got to take care of somebody who may be suffering from coronavirus, and also to share her journey with this infection. Let's start with the tips. Tip number 1 would be to keep a thermometer at home. One of the symptoms that you can really put a number on and really monitor is the temperature. So make sure you've got a thermometer at home. Don't just assume that it works. Check to see that it works. And if you don't have a thermometer and you're not able to order one online or purchase one from your local pharmacy, then make sure you at least know of somebody who's willing to lend a thermometer to you. It could be a neighbor, it could be a friend, and of course any borrowed items should be disinfected before you use it. Tip number 2 would be to keep a box of paracetamol at home just in case you feel unwell in the middle of the night. Know how many and how often you can use. So paracetamol, normally you can take 1 to 2 tablets 4 times a day when necessary. You can take a maximum of 8 tablets every 24 hours. Be sure not to take more than that since it can cause liver damage and overdosage. Paracetamol can't be taken with cocodamol and codidromol because cocodamol contains codeine and paracetamol, and codidromol contains dihydrocodeine and paracetamol. So taking paracetamol on top of those medications could just lead you to overdose. If you're unsure about what medications you're allowed to take paracetamol with and which ones you're not, you can contact your pharmacist. Tip number 3 would be to know things like respiratory rate, otherwise also known as breathing rate, which refers to the number of breaths that you take per minute, and this should be somewhere between 12 and 20. You can measure this at home by counting how many times your chest rises and falls, and if you're suffering from an infection, it's more likely that your breathing rate will be on the higher end. I didn't give any ibuprofen to my mum since at the time, around March, there was mixed evidence in terms of effectiveness of ibuprofen, and also it is known to have more side effects such as tummy upset, and it can sometimes worsen asthma. So I avoided ibuprofen altogether. The updated advice by NHS England is that ibuprofen can be used, but paracetamol should be tried first. The next step would be to consider investing in a pulse oximeter, especially if the person you're taking care of has tested positive and is recovering at home. This is a small size device which clips painlessly into your fingers and measures the oxygen saturation. Normal oxygen levels are between 94 to 99. What I normally did with my mom was I took 3 readings and I just took an average to see how she's doing. When she came back from the hospital, her oxygen levels were quite low. I made sure to keep my room well ventilated and I would keep the windows open. I wouldn't let her sleep with the windows closed. I would make sure the air is circulated. The other really important thing is to not put any emotional pressure onto the patient. Make sure, that they're not put in a position where emotionally they've been put on such stress that they start breathing really heavily and they start crying. So that's really not good. One of the more severe symptoms of coronavirus is breathlessness, and emotional stress just doesn't help at all. If you're really unwell, if you're really struggling to breathe and you're deteriorating, then call 999. Don't suffer alone. The next step would be to make sure that they get plenty of rest. It's really important that they get rest, but equally they should also move around, do light exercise, some light walking in the garden. Make sure that they're drinking plenty of fluids and avoid dehydration. Your urine should be light yellow or clear in colour. Make sure that you put real focus on hand hygiene, and you're also protected in the sense that you wear PPE when being in close proximity with them, and that involves wearing masks, that involves wearing aprons, and I'll talk a bit more about that later on. With the continuous cough, if your loved one's got a continuous cough and they've tested positive, make sure that they avoid lying on their back. It's really important. Sleep posture, lie on their side or sit upright. That can really help to alleviate the continuous cough. Testing is available in England, Scotland, Wales and Northern Ireland. Don't wait to apply for the test. If you have symptoms, then apply for the test ASAP. More information on testing can be found on the NHS website, and I will talk more about the tips at the end of the video. So I'm now going to talk about my mum's journey with coronavirus. So I came home one day and she told me that she had this really bad headache and this raging temperature. I honestly just thought that she was run down because, you know, she normally overworks and she had been working through the weekend. I just thought that she's caught a bug. She doesn't have any past medical history. She's a relatively healthy 40-year-old woman. We didn't suspect coronavirus at all at that point. She's normally not the type of person to want to take medication straight away, so we didn't use any paracetamol. She just rested for the evening. Day 2 and day 3 still had the raging high temperature and she still had the headache. We went to our local walk-in clinic and the doctor looked at her vitals, looked at the blood pressure, pulse, temperature, and you know, everything came back normal other than the temperature. So the doctor didn't suspect any COVID because she only had the high temperature. She didn't have shortness of breath, she didn't have any cough, she didn't have any change in taste or smell. So they suspected a viral illness, but they didn't suspect any coronavirus. The doctor just advised her to rest and take some antipyretics, meaning taking some paracetamol, any painkillers, hydrate with adequate fluids, and to stay off of work until a febrile. Day 4, 5, 6 and 7, she still has the high temperature. She doesn't have any cough, she doesn't have any other symptoms, but then she starts to lose her appetite, she starts to feel tired, fatigue, and she is actually complaining about body aches at this point. Temperature was really high, it was getting to 39.1 to 39.5, and we were hoping that she would just get better so we wouldn't have to go back to the walk-in clinic. But she just didn't get any better. At this point I noticed she wasn't as chatty as she normally is. She didn't want to have a conversation. I just knew something was off and I started to feel a bit nervous for her and started to suspect that it might be coronavirus. I always told her it's probably not coronavirus. Just keep a positive mindset, you know. You're young, you're healthy, you can probably fight it off. Day 8. She's still not better, she's got raging high temperature, but on top of the temperature, she's now got slight breathlessness. We took her to the hospital. Actually, the ambulance came and took her, and the doctors examined her, ran some blood tests. They tested her white cell count, her neutrophils, her CRP, which are all the infection markers. Again, they suspected viral illness, but they said that it's unlikely that she's got coronavirus, and they didn't do a swab test the first time around. We gave her some IV fluids, advised her to take some paracetamol, you know, keep a safe distance with relatives, not to use public transport, and stay off of work, and if breathing becomes difficult, to contact 111. She came home, we followed the advice. So day 10, she was still not feeling better despite the paracetamol, despite keeping hydrated at home. She's in fact started to get worse. She started to have weakness and she would have pain on the left side of her back, and we would think, what on earth could that be? She had to be hospitalised again for a second time, and this time they took a chest x-ray and it showed that her left lung had been affected and there had been fluid building up. So she was diagnosed with COVID pneumonia. They definitely suspected COVID. They ran some swab tests and it came back positive, and that was so shocking for us. Many of you may not know, but we came to this country 11 years ago. I was 13, my younger brother was 10. My mum had a great job back in Nepal. She had all her friends, all her family, all her loved people, everyone that loved her were back there. She gave up all of that to move us here to the UK so that her children could have a better future. And since the day that she's came to the UK, she's always been working, constantly working to provide for us. And I've never seen her take a single day of sick leave. And I've never seen her being so poorly all these years. So when I got the confirmation that she was positive and the doctor told us that there isn't anything really they can try at this point, and the hospital can only offer her symptom management and keep her comfortable. It was such a shock because I just couldn't comprehend that this was her life. So day 11, day 12, you know, her symptoms worsened. At this point, she's hospitalised. We're obviously not allowed to see her since there was a risk for us to get infected. I truly felt lost, you know, breathing was difficult for her. She was in a lot of pain. Due to her lungs being infected, and I would ring her on her phone and I would ask her how she's feeling, but she didn't even have the energy to put the words together to form them into sentences. She was very breathless. She would try and respond to me, but I couldn't get much out of her. The only time she would call me was when she was in immense pain and she couldn't bear it, and she would call me explaining in a breathless voice that she's in pain. To be on the other side of the phone, not allowed to hold her hand, to tell her it'll be okay, and to tell her to be strong, even though I didn't feel strong inside. It was really difficult, and I had to be strong for her and tell her to be strong and have hope, even though I didn't have hope myself. She needed oxygen support for breathing, she needed strong painkillers, she needed IV antibiotics, she needed blood thinners. The doctors repeated the chest x-ray. Now at this point both her lungs were affected and the outcomes were worse than they were before. The doctors, all they could do was give her some supportive measures and tell her to keep a positive mindset in order to improve her recovery. So 22nd of March, as per the British calendar, is Mother's Day, and I didn't even get to talk to her. She was so breathless. I could only send her a text saying Happy Mother's Day, and that was about it. I didn't know if at the end of all this I would have her back. By the looks of things, she was getting worse by the day. There was no clinical improvement, and I just didn't know if I'd have a mum after that. I'm the oldest in my family. I've got a younger brother and I've got my dad, but you know, my life really flashed in front of me, and I thought of the worst thing that would happen, and I thought about what would happen if she didn't make it. And you know, I finished university and I work full-time now, and I could easily support myself, but I didn't know if I could move on with my life, and I knew I would be an emotional wreck if something happened to her. Also, I've never been able to do anything nice for her. It just occurred to me. I've always been studying. She's always been working. I've always been working. So we've never even been able to be on a good holiday. I've never even been able to give her a nice gift or spend quality time with her. I wanted a second chance with her. I promised myself, you know, if God was kind enough to save her, that I would literally live my life differently, and I would be so much more grateful. I'd spend so much more time with her. I'd appreciate her more. After a few days of intense treatment, you know, she was eventually discharged home, and I can't describe how happy I felt. They told us that she's still not 100% recovered yet, but we really need the bed for other critically ill patients. So, you know, she's still very fragile and you've got to take care of her. So at that point, I made it my mission to make sure that she was fully recovered from the moment she was discharged. I made all her meals. I made sure she was following a healthy, balanced meal. I followed the NHS Eat Well guide to plan her meals and to make sure that she was getting the nutrition she needed to recover. I made sure she was drinking plenty of fluids. I made sure her room was clean and disinfected every single day. I encouraged her to move around. I checked her vitals. I checked her temperature, blood pressure, pulse, and oxygen saturation using the pulse oximeter every 2 hours. I made sure that she was taking her medication. I encouraged her to take vitamins, mainly supplements such as vitamin C, multivitamin, vitamin D supplements. I would, you know, put on positive inspirational talks and positive sort of music for her to listen to even when she was sleeping. I really wanted her to focus on getting better. I would avoid putting on the TV and putting the news on because I've noticed that would just get her more and more anxious. And once she recovered and, you know, she was well enough to breathe and she was well enough to talk to me as normal, it was such a relief. It's one of the hardest things that I've been through. It was definitely a difficult time for me and my immediate family. Her parents were worried and, you know, I was really worried. My brother and dad were really worried. There's so many things I haven't done. There's so many things I'd like to do. So many things I've got planned for her, and she really deserves the world. And, you know, anyone who's met my mum will tell you that she is such a kind and joyful and compassionate and giving soul. I'm just so happy to have her back. She's now doing things at home like gardening and cooking, and she's able to do things that she loves. When she was unwell, I remember she didn't even have the energy to talk to me on the phone when I rang her and said, "Mum, how are you doing? Why don't you talk to me?" She didn't even have the breath or the energy to say anything back to me. And now when she sort of shouts at me from the bottom floor and tells me dinner's ready or why aren't you here yet, I sort of think back and I think how lucky I am and how blessed I am to have her back again. And I now know what I didn't know before. It's really not the materialistic things that matter. It's really not money. It's really not anything. It's just a relationship that you've built with the people closest to you and spending quality time with them. And for me, my mom is so brave. She's so inspirational. I've really worked in our relationship now more than ever, and we're more like friends, and I wish I had lived my life like this from before. And we'll stop my rambling. So some more tips on how to take precautions against coronavirus. Stay at home and self-isolate if you've got symptoms of coronavirus or you live with people that have got symptoms of coronavirus. If you yourself have got symptoms, meaning if you've got a high temperature, if you've got shortness of breath, if you've got change in taste and smell, if you've got breathlessness, then make sure you self-isolate at home for 7 days and seek the help that you need. Hand hygiene is also really important. Make sure to wash your hands for 20 seconds using soap and or alternatively you can also use hand sanitizer. And the most commonly missed places when washing your hands are thumbs, in between your fingers and wrist, and make sure you cover all the areas. Wash your hands after blowing your nose, sneezing, coughing, before you eat, before you handle food, when you return home from outdoors. Just be really careful. I think if there is ever a time to be careful, it's now. And avoid touching your face, touching your eyes, nose and mouth with unwashed hands. And stay clean and wash your hands, and clean and disinfect surfaces that are frequently touched at home, such as door handles, smartphones, laptops. And when you're outdoors, make sure you keep 2 meters distance. Make sure that you wear something that covers your mouth, nose, especially in public transport, or when you're taking care of somebody who's suffering coronavirus. It's quite important that you protect yourself. If you've got COVID symptoms, or you live with somebody with COVID symptoms, don't leave your home even with a face covering on. It can sometimes give you a false sense of security, but actually you're still likely to spread it around. Use separate towels for different members of your household, and minimize the time that you spend in communal areas such as kitchens or any shared sitting areas. This can be a very isolating and very scary time, but make sure you look after your mental well-being. Watching the news can make you feel more worried, so try and limit the amount of time that you're watching and listening to the media coverage of the outbreak. This part is probably going to be the most important part. So yes, of course it's important that you take care of your loved one who may be suffering coronavirus, but it's even more important that you stay well and healthy, and you are strong, and you are physically and mentally healthy and well, just in case somebody in your family does fall ill, so that you are perfectly capable of taking care of them. Make sure you eat a healthy, balanced diet with lots of fruits and vegetables. Make sure that you drink 2 liters of water. Make sure that you take your vitamins, vitamin D, multivitamins, vitamin C, and make sure that you regularly exercise, and obviously don't smoke and drink. Be alert and stay safe. On a final note, I just want to say thank you to every single person that, wished my mum in her path to recovery. You may not be aware, but it has actually really helped her to recover quicker, and I'm just really thankful to each and every one of you that has, checked up on her and checked up on us as a family. And I'm also really thankful to all the NHS staff that took care of her when we couldn't take care of her at home. Just want to say thank you to the NHS. I'll see you guys in the next video.